The facility has a catchment population of 4,838, whereby we also see an average of between 50 and 100 clients in a day. I joined this facility last year in the month of October, and immediately I arrived, I found out that there was no water in the facility, compared to my previous facility where we had the hand washing and all other facilities, just because we had water in that facility. But coming here, we didn't have any source of water at hand. So it brought a lot of challenges, because number one, we are supposed to do hand washing after every service to our clients. Now we cannot do that, and as at now we don't have adequate sanitizer. So now there's a problem to do with the hand washing in the facility. Number two, the services that we are offering to our clients, minus this water, is not possible. Clients themselves, they're supposed to get safe water for drinking and also for use, for example, the maternity mothers after delivery. So without water, then it's not possible to offer these services. The only source of water that we have currently is the roof catchment, which comes from rain, but now the supply is not adequate, especially during the dry season. So it has posed a challenge whereby clients who come in the facility who are seeking services, for example, the ANC mothers, they are forced to carry their drugs home so that they can take with the water at home, just because there's no water in the facility. We cannot offer adequate hygiene in the facility because cleanliness is usually done 3 times a week, whereby we are supposed to pay for someone to go and fetch water from a nearby river. Therefore, it poses a great challenge to the facility, especially now when we don't have adequate funds. We have services that are offered, like the maternity services, whereby after delivery, this mother is supposed to get a bath, to shower, so that now she can go home fresh. But because of the water challenge, we are not able to give these services to these mothers. So these are the major challenges we are facing in regards to lack of water in the facility. The facility offers a variety of services to include the ANC mothers. We have the child welfare clinic. We have the family planning services. We have nutrition services. We have the outpatient services, that is the treatment of both under 5 and over 5 clients. What prompted me to do nursing is because in the year 1994, I was hospitalized at Busia Level 4 Hospital because of cellulitis of my right hand. So during my admission, there was we had interaction with these nurses at the facility. So after getting their service, I used to find myself pushing or assisting them push the drugs trolley from one bed to another, and that one inspired me most, because by the time they were discharging me, they had already nicknamed me Dr. Kascon. And so it was my pleasure that one day I'll be in the medical fraternity. It was last year in the month of November. I was just 1 month old, and there's this mother who came for delivery. We successfully delivered this mother, but unfortunately we didn't have water in the facility. So we had these soiled linens, and also this mother was supposed to get a bath just before she left the facility. So it was unfortunate. The mother had to go home and take bath from home. For the facility, we had to keep the soiled linens and the floor, which was also soiled, up to the following day when we could now source water from our normal source, that is the river, so that we can now do the cleanup. So as a facility, we are trying in the limited resources that we have to make sure that we maintain the facility to the required standards of cleanness as we wait for someone else to chip in and assist us to acquire water as a facility. As much as we are facing these challenges, we are always proud, and I'm also proud to be a nurse, and I promise to continue offering the services as trained and to the required standards. So my plea is to all the well-wishers just to come in and intervene so that the facility can get clean water and in the required quantities, so that now we can continue offering services to this community. The community is also affected because they are also required to fetch water from the same river, which is distant. So by bringing water close to this facility, we shall also be assisting this community to get adequate water and also safe water.